Ball? Yes. There we go. Ball? Yes. Push? Feel the difference? You feel? Yes? Pain? Okay. Pain? Yeah. Okay. Push? Yeah. Boom. Okay. Hold? Push? Yeah. There we go. Relax. Okay. Push? Push? You feel the difference? Yes?
Yes.
Push. Right? Okay. What's up, everybody? Dr. Ranen here. Today, I have a very special guest. I have Julia. Julia is an IFBB Pro, and she's going to be competing in Spain in just over 8 weeks. Today, she comes in with left-sided lower back pain. It's not affecting her training as such, but it's been there for a long period of time, so she wants to get it looked at. She has been doing some massage and other types of therapy, and it doesn't seem to be working. So we're going to go ahead and assess her lower back. We're going to see what we can find, and as always, we're going to see what treatment we can provide for her. We're going to start off with our neurologic examination, and we're going to go from there. All right. Oh, Julia does not speak much English, so we have our translator here, and so she's not mic'd up for the moment, but we're going to try and communicate as best as possible. Okay. Okay. Can you do this? Pull apart. Look up. There we go. Okay. Relax. Can you feel this? Yes? Here?
Yeah.
Here? Same. Yes? Okay. Lift up. Hold. Push. Good. This side. Push. Good. Down. Yes. Push. Good. Down. Push. Push, push, push. Good. Okay.
Very strong.
Very strong, yes. Straighten this leg for me. Lift up. Toes towards you. Head down. Forward. Pain? Any pain in the lower back? We need a translator. When you bend forward, do you have any pain in the lower back or stretching in your leg? Let's try again.
No.
Nothing on the left side. Okay. Let's do this side now.
Yes.
Yes?
Yes.
Left side. Okay.
Yes.
Stand for me, please. What is pain in Russian? Pain. What is the word for pain in Russian?
Боль.
Ball.
Боль.
Ball.
Боль.
Ball.
Да.
Okay. This way. So, we know one word now. Okay.
We're gonna learn Russian
Yeah.
after this session.
Ball.
Yes.
Yes. There we go. Up straight. Ball.
Left.
Left. Okay. Ball.
No.
No.
Only stretch.
Ball. Yes. Ball? No. Okay. Okay. Bend forward. Forward, yeah. Slow, slow. Ball?
No.
Here?
No.
No. Okay. Okay. On your back, please. Facing up.
Okay.
Yes. You okay?
Small.
Too small, yeah?
Back.
Ball?
No, no.
Nothing?
No.
Okay.
I have a very nice stretch.
Yes.
Stretching.
You can come down a little if you want. Come down. Yeah, there we go. Okay? Okay. Loose. Loose, yeah. Ball? Here? No? Okay. I will do some muscle testing now. When I ask you to push, you need to resist against me. Okay? Push. Up. More. Good. Okay. Good. Okay. In. Good. Hold. Push. Feel the difference? You feel? Weak. Yes? Pain. Okay. Wait, wait. Like this. Yes. Turn out. Yes. Go. Pain? Here. Okay. This way. Go. Oh. You feel the difference? Go. Yeah. Okay, guys, so this is very interesting. Of course, Julia is a IFBB Pro. She's the elite of the elite. In her training, she does not notice any weakness between the right leg and the left leg, but we can clearly see when testing that there is a weakness. This is why seeing a professional when you are weekend warrior or professional athlete is very important, especially seeing someone that knows how to do muscle testing, because there's a lot that I can take from this. Already in my mind, I'm building an idea of what's happening, why the pain is there, and why her lower back pain isn't getting any better. It's very clear to me now, in fact. Okay? Okay, Julia? Go. Good. Go. Oof. Pain. Okay.
Ball.
Ball. Ball. Yes. Turn on your side. Yes. Side. Yes. Yes. Straight. Okay. Forward. Yes. Okay. Push up. Good. Push up. Up, up, up. Good. Okay. This side. Hold. Whoa, whoa. Whoa, whoa. Okay. Push. It's okay. Push. Yeah. Boom. Okay. Face down for me. Face down. Left side. Okay. Okay. Push. Good. Push. Good. Hold. Push. Up. Good. So what I'm doing is I'm testing hamstring and glute max. Ball? No? Hold. You can see how the leg starts to drop here. Push. Pain? No. Okay. 1 second. Hold. Hold. Push. Yeah, there we go. Relax. Okay. Ball.
Yes.
Ball.
Yes.
Ball. Yes. Ball. Ball. No. Okay. Okay, guys. So I have just briefed Julia on what the problem is and what we need to do to solve it. Essentially, a little bit earlier in the video, I was telling you that muscle testing is important. Why is it important? Well, based on the muscles that I was testing and the weakness in these muscles, I can correlate it back to the spine particular level or a particular level that may be affected. And when I palpate her spine, she's having sensitivity on the spinous process of L4, L5, and of S1. And a lot of the muscles that are weak are supplied by the nerve roots of those levels. Based on the duration of pain, the fact that the pain is there in the morning, the muscle weakness, the lack of response to massage and other types of therapy, more than likely I think that she has a disc injury. Maybe a mild disc bulge, could be something more serious, could be something less serious. Maybe it's just a facet joint subluxation or some facet joint arthritis. I'm not sure, but I know that there's something happening at that level, in particular L5, S1. So we're going to start with our electrostim and we're going to retest it and we'll end with some spinal manipulation. Let's go. What are you training today?
Shoulders.
Shoulders.
Yesterday legs.
Yesterday legs, yeah?
Pain.
Pain. Okay. Okay? All good?
Yes.
Relax. Ball?
I don't know.
You don't know?
Feeling.
Yeah? Okay. Okay. Right. Let's get you to turn over. Face down.
Face.
Okay, so you're gonna work the glute max now. And we have one last one, which will be glute med. Okay. So we did ask Julia to do a change fast. The reason is because I wanted to get access to her lower back. So what we're going to do now is some intramuscular electrostimulation of her paraspinal muscle. So Julia has been training for a considerable period of time. The likelihood of something happening to her disc is pretty high, whether that be a disc injury or degenerative disc. So I always want to stim the muscles around the levels where there's great sensitivity. Sensitive? Ball? Yes. Okay. Okay guys, so for those of you who are loyal subscribers, you would know that I generally like to do my intramuscular electrostimulation around the lower back, around the neck, after I do my spinal decompression. But as you can see, I am not in my room today. Unfortunately, the ACs are down and Dubai is extremely hot, so I'm working in one of my colleagues' rooms for the day. What we would probably do is we'll reassess Julia in like 7 to 10 days. We will reassess her, see how she felt after the initial session. And if she's still more or less in the same position, we will introduce the decompression to her, and that should make a big difference. If you like what you see, please hit the like button, please subscribe. If you have any questions, drop it in the comment section below. If there's one thing that I would like you to take from today's session is that just because you can't feel dysfunction does not mean it is not happening. We saw the difference between Julia's left and right leg when performing the muscle testing. It's evident, it is clear, okay? She didn't feel the weakness, but it is there. She's getting some stim of the nerve here. You okay?
No sleep.
Sleep, yeah.
No sleep. Okay, you can see there's a big leg length difference here. Okay. Can you lift your right leg from your hip? Yes. Up. Down. Okay. Down. That's much better. Okay, down. Right. C. Okay. Left. Much better. Okay. So that's called a passive hip extension test. It gives us an idea if a patient's pain is coming from the level L4-5 or L5-S1 when we are contemplating if the pain is a problem related to the facet joint. So let's do some muscle testing. So essentially what that showed me was that there is a subluxation or malalignment of the L5-S1 joint on the right side and potentially a misalignment of the sacroiliac joint on the left side. Up, hold, push, up, push. Good. On your back. Turn over. Turn over. Okay. Lift up, hold, push, push. You feel the difference? Yes?
Yes.
Turn. Now, push, push. Right? Okay. In. No, keep it here, down. Okay, in. Go, go. Good. Okay? On your side. On your side. So, I think the glute min was fine, but the glute med wasn't. Straighten. Straight. Okay. Back, 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 back. Push, 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 push. Good? Yes? All right. Come to the edge. Look up. Breathe in. You good? Come to the edge for me. Come, 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 come. Where are you from in Russia? Where?
Moscow?
Moscow, St. Petersburg?
No, Tambov. Small.
Small.
Yeah.
Okay, okay. See, you always go to the places you know. Yeah. Okay. This one. Roll, roll. There we go. In, out. Good. Sit for me. Oh, no, no. Sit. Sit. Feet up. Yes. Nice.
All.
Or release. Okay. Sit for me. Over. Okay. Left leg straight, toes towards you, Head down. Ball.
Small.
Small. Better.
Better.
Yes. Stand for me.
Better.
Stand for me. Stand. Yes. Turn. Face this way. Okay. Ball. Here. Okay.
No. Here.
High up. Okay. Ball. Ball.
Little.
Little. Okay. Ball. No. Okay. All right. You can sit. Okay, guys. So essentially what we've seen is an improvement in several of our positive assessments. Slump test is negative, which means that there's less nerve tension. Extension is still positive, but extension is going to be positive if you have a disc herniation or if you have a degenerative disc. Lateral flexion to the right was causing pain to the left. That's better. Kemp's test to the left is also better. So I think we've got a 2 out of 4 improvement there. And in terms of muscle strength, all the muscles are better. So we've done pretty well today. What we would do is we would see Julia again in a couple of days, as I mentioned, and we would do some decompression of the lower back and see if that makes a difference if her morning pain doesn't get better. Okay, guys, that brings an end to today's session. Julia and I just had a full-on conversation using Google Translate, me trying to explain to her what she should be looking for in the session. So if you say or you found that we haven't really spoken much, this is why, okay? We're taking a lot of effort behind the scenes to communicate. All right, so Julia, do you want to share with our viewers where they can find you on social media?
Yulia Glazicheva, IFBB Pro.
There we go. All right, guys, we will drop Julia's handle in the captions. Yes? All right. Thank you very much, guys. We'll see you soon. Cheers.